everyone, and welcome to Being Black in Britain, the podcast that captures the nature and the essence of the Black experience across the UK, starting with the north of England. So today I am joined by Tilly, representing AfroMindz. I hope you enjoy this episode. Let's get to it. Tilly, thank you so much for joining us today. Really excited. I just want to spend today exploring a bit about you, your body of work, specifically with AfroMindz, what it's contributing to the community, and how we can engage with you and the team, the organisation, and what's coming up next, really. So first and foremost, who are you? Who are you, Tilly?
That's always such an interesting question because you feel like you've got to tell your whole life story when someone says, who are you? But my name is Tilly. I'm also go by Titilope, which is my Yoruba name. I am a co-director of AfroMindz, which is a documentary about mental health and specifically in the Afro-Caribbean community. So the documentary was made to explore stories and experiences of Black people specifically, and looking at how their faith and their culture impacts their attitudes towards it in general, really. Mm-hmm. The team is made up of 4 women, me being included as a co-director, and Bolu, Jimmy and Michaela. So it's a team of Black women from different walks of life, really. Mm-hmm. We all have different sort of day jobs, but we've come together because we're all passionate about this subject, which is mental health in the Black community.
Brilliant. And How did this begin then? What was the heart, the inspiration behind AfroMindz coming together?
So very interestingly, I used to go to the same church as Bolu, and I think there was just a day, I'm not quite sure whether we had a sermon that was around it, but there was a day after church where we ended up talking to each other about mental health and the fact that we kept hearing similar stories in terms of people's experience within the church and how difficult it was for them to navigate their mental health and sort of what they believed in, which was really about their faith in God, and how does that kind of work with maybe struggling with your mental health. So we immediately, when we were having that conversation, we're like, okay, this is a repeated occurrence. Right. It would be really interesting if we look a little bit more into it and see how that plays out. And because there isn't a lot of like content out there exploring faith and mental health, and even just maybe specifically Afro-Caribbeans thoughts and perceptions of it, we thought it would be a really good idea to just let's see what we can do. And I don't know, I'm always somebody with big ideas. I'm like, yeah, we can definitely make a documentary. Not that I had any experience in videography or anything like that, but Bolu thankfully does. So we kind of put our heads together and decided we'll start to ask people if they're interested in telling their stories on camera.
Okay. And how was that journey then of having an idea, identifying a need and trying to explore it? What has that been like over the last couple of years?
It's definitely been like interesting. We've gone through different phases. Like at the beginning, it was just about how do we actually get people to sit down with us and have really personal conversations, because that is a big ask, to be honest. Yep. And then also after we actually got through that phase of actually getting people to sign up for it, then the actual work behind how are we going to logistically put this together, because most people weren't in the same cities and things like that. And then after that was also the post-production issues around reaching out to different communities and getting people to watch the documentary. So we've gone through lots of hurdles, I would say, in the entire process.
Yeah. And wasn't this during COVID that you done? Was that before, during, after?
We started during COVID. We started before COVID, and then COVID hit. Obviously, nobody could predict COVID. And then that literally put a spanner in the works because there were so many rules around seeing people. We didn't want to flout the rules, and because of the safety issues, we didn't want to put anyone's health at risk. But it also meant that we had to pause a lot, stop and start, which was definitely not the idea. It made it very difficult to finish it in the time that we thought we would, but we just we couldn't do much about it. We just had to adapt.
And in terms of then engaging with people, because yes, we have seen that, you have conducted a series of interviews with people across the UK. What have been the highlights of your findings? What has maybe struck you, or what have you kind of identified as key areas of concern, development, or for further exploration?
I think that because AfroMindz sort of explores a range of issues when it comes to mental health. So it talks about depression. We explored a little bit about psychosis, also suicidal ideation, and also just in general trauma. All those areas are different, and they're quite, if you want to look into them in detail, you'll find that people's experiences can be very, very different. But I think one of the common factors was really around people just not feeling comfortable enough to speak up at certain points, which would have helped. Like if they had spoken up earlier, they would have been on their healing journey a lot faster. So that's like a common thing that we've heard.
Are there any other areas of concern that were brought to light there?
Yeah, I think one of the biggest ones for us is because whilst we were trying to find people to actually volunteer for the documentary, we really wanted a bit of a wide range of genders, for example. We couldn't, honestly, we found it quite challenging to get the males to actually share their stories. So
why is that?
To be honest, it's quite typical for men not to want to talk about mental health. So that's why we've got quite a few charities that do focus on male mental health. But for us, it was really a shame that we couldn't get those stories. We got about maybe 2 or 3 within the documentaries, but we wanted really the male perspective on it, especially from an African and Caribbean perspective.
So was that you reaching out and them saying no, or was that you not being able to kind of access them in the first instance?
It was a bit of both. There were some people that said yes and then changed their minds last minute because they just didn't feel comfortable. And that's completely understandable. But it was really difficult, to be honest, to even get men to even just say yes in the first place. Whereas for women, it was really not as hard. Like people were willing to share their stories. But I think for men, there are a lot more things to address. It's not just a cultural thing. There's also the male perspective of I have to be a certain type of way in front of my friends. My friends are going to see this video, what they're going to think. There's a lot around that, which I don't think is the same for women because I feel like we're more of the way we interact as women is different to how men interact in their social groups. So I think that makes it a lot more challenging for men to be able to have conversations that can be quite deep.
I think thinking back to sort of growing up and looking at the community that I was raised in, again, Black African church, Christian community, again, for me, it's looking at the expectation that was put on a man to present in a certain way. You had to be strong. You are the one that keeps the house together. You're the one holding everything together. So I guess if that's how somebody's been raised to present in that way, you don't show weakness and vulnerability. Not that it was explicitly said, but that it was something that was suggested and in a way that there's a lot of men I don't ever remember or recall seeing them express emotions.
And sometimes it is explicitly said, like men don't, you're not supposed to cry, you're a boy, be a big boy. Little throwaway comments that kids grow up with can actually really impact how they behave in the future. So no, it was for us a challenge not to have enough male representation because we really did want that. But what we find really interesting is when we've had screenings and men have come along, they've really been quite receptive to it and actually been like, actually, it's not what I expected. It's a lot. I've learned something from this. So it's been good to have that positive feedback from that group.
And just going then back to sort of upbringing and culture and how the expectations that are maybe placed on certain genders. I feel like that's now a whole body of work in terms of how do we undo that from a younger age? So how do we reach Black children and encourage them to be comfortable and confident enough to express wherever they're at? And how do we give them the language, the vocabulary to actually express what is their experience? Because I find that sometimes it's be quiet, stop talking, stop crying, stop this, that there's been a lot of sort of silence and a lot of police, and that a child hasn't actually learned how to say, I feel this because this, or in this particular circumstance or scenario, this is how I feel. So because a child hasn't learned to kind of process their emotions or their experiences, then they grow up and they don't know how to articulate. So how can the person say, this is what my mental health looks like right now, and it's potentially because of this?
I think it's really sad that I say we in terms of African Caribbeans, we've taught men that it's not okay to express their emotions. It's almost like the better thing to do is to deal with it on your own, because that's what a strong man would do. But that's not right because it leads to situations where, for example, the extreme situation where you think someone's fine and then all of a sudden you're hearing or you're reading stories about Black men committing suicides. And it's like, where has that come from?
It's not out of nowhere.
It's definitely not out of nowhere because you just don't know what's going on with them. And that's the challenge. We want to teach young Black men that it's okay to express yourself. It's okay to speak to another person about how you're feeling. It doesn't have to get so bad for you to actually, you know, ask for help.
Yeah. And expressing is not a measure of your masculinity,
No.
you know.
And sadness isn't a negative emotion. I think for
It's
some
a
reason...
human emotion.
Yeah, exactly. People kind of put it in a box. Being sad is not a negative emotion. It's just an emotion. It's like, I'm happy, that's an emotion. Sadness is an emotion. Being, being excited is an emotion. They're all just emotions and you have to process them. And that's how I see it now. But it's taken me a while to even understand that as well.
Yeah. How do we respond to that then? Or what were the factors perhaps hindering or obstructing people from speaking up and being confident to share what was their problem, challenge, issue, concern? Yeah, what were the factors kind of stopping people from speaking up?
I think a lot of it is perception and stereotypes and cultural nuances around the topic itself. For a lot of people that we did speak to in terms of the documentary, they're from an African or Caribbean background where mental health, even though it's getting better now, we're getting a lot more discussions around it. For a long time, it's become like it was a taboo topic. People didn't know how to express it without feeling like people are going to look at them as weird or just automatically think of the worst case scenario. So for a lot of them, it's just that, how do I go to my mom, for example, and say that I'm really struggling with dark thoughts without maybe freaking her out? So there's a concern of like protecting your family members, wanting to make sure that they didn't, panic about your health condition, but then you're not getting any help. So there's a balance. I think a lot of people found it difficult to kind of like understand how they would do that, ask for help, and then protect their family members in the same breath.
Yeah. That's really interesting, that trying to protect your family members or trying to protect the people around you at the expense of yourself. That's really sad.
Yeah, it is really sad.
Okay. And in terms of responding to some of those issues then, in terms of looking at the barriers to people speaking out or maybe even progressing to access help, the question then becomes how do you think AfroMindz might be able to start responding to some of those things? What do you think are the first steps to trying to challenge or deal with those concerns?
Yeah, so I think because we initially started the documentary from a point of awareness, we wanted to, because awareness for us is like the beginning, to actually get people understanding that this is normal in our community. You can actually have a conversation about this without it being a negative thing. It should be an open discussion that you should feel comfortable having. So for us, that's where we started. Obviously, we've learned a lot since then. But like I say, we are all four of us are from different walks of life in terms of profession. So we don't necessarily see AfroMindz as potentially, like from a mental health perspective, maybe a psychologist point of view, we don't necessarily see us as the solution.
Right.
We do see ourselves as people that can signpost to other experts. And what we do see ourselves doing also is creating awareness in spaces, corporate spaces, where they have mental health campaigns that aren't necessarily targeted at ethnic minorities, for example.
Right.
They have a bit of a gap in terms of the type of content that they are pushing out to their staff, for example. They are missing a select group of people that they should also be supporting.
Right. Okay. And then stepping out of the corporate space, are there any other areas that you might, or any communities or groups of people that you might engage? Or is it strictly that you want to step into the corporate space sort of organisations and engage in conversation with them? Is there anything else?
To be honest, it was a bit of a surprise for us that the corporate space needed the documentary.
Right.
Initially, we really just wanted to focus on churches.
Okay.
Because that's how it started. It was that conversation in church. So we really just wanted to literally give the documentary to churches to have open discussions to trigger them to start thinking about it in a different way. So that is still kind of at the heart of what we want to do. But that's also been probably our biggest challenge, to get churches to engage in those conversations.
Yeah. 'Cause in my mind, I'm already thinking, how do you approach a church community and convince them that there is a need to engage in this very specific conversation, and convince them to give you the space to engage their community? That demands a strategy on its own.
Definitely. And it's very difficult because churches have their own sort of beliefs about mental health. And what we don't want to do is like go in there telling them that they're wrong, because it's not really about that. It's just about, okay, we need you to kind of open up a little bit and think about the fact that there are different people in your audience and they might be struggling with different things. So you need to kind of understand where they're coming from. And also what we want churches to do is spend a bit more time maybe upskilling those who are having conversations with people, because you have counselors within the church. I mean, they don't maybe wear those official titles, but there are specific people that people would go to have conversations. I think it's just really important that those people are trained and they are part of the solution and not part of the problem, because sometimes they can actually be part of the problem, sadly.
Indeed. That's a whole other question then. So how do you think that might work in terms of equipping people within faith communities to engage in mental health conversations? Is that signposting them to sort of organisations such as Mental Health First Aid England, where they already deliver training around sort of adult mental health or child mental health? Is it perhaps using the interviews or your findings as case studies and using them to explore some of the core issues arising within faith communities? What would that look like for you in terms of equipping faith communities?
I think it's definitely a bit of both, to be honest. I think a great step would be to make sure that the people that are having like face-to-face conversations regularly are mental health first aiders, for example. But what we've also found doing the documentary is that there are organisations that are faith-based that do training as well. They do a lot of workshops and they come into the spaces knowing the kind of like the background of what churches can be like and how to approach the conversation. So we would signpost them to those type of organisations as well. As well as like literally the documentary is a great place to start, because then you can explore the conversations that we've already seen happen and then look at your church and think about whether that's happening as well.
Okay, yeah, I'll take that. And slight deviation, coming back to yourself, Tilly, my question becomes, why did it have to be you? Why did it have to be you, Bolu, and the girls? Like, why did you feel that actually we've identified the need and this is how we want to respond? Why didn't you just kind of pass the baton or the responsibility to somebody else?
That's really a great question, to be honest. If I think about it, it was quite personal when we first started. I'd seen certain things happening around my immediate circle, people that I'm quite close to. And it really, really, really bothered me, to be honest. I just wanted to find a way to kind of get answers in a way that wasn't me going to maybe a therapist, but weirdly enough, the entire process was a bit of a therapy thing for me as well, just learning from the experts. Because with AfroMindz documentary, we actually spent quite a lot of time speaking to professionals, doctors, and that really helped me, like it really educated me on the subject. I'm way more like clued on now that I've gone through that process, but it was very personal for me because I'd seen people really, really struggle and I've seen it handled in such, not always in the best way. So it was really important for me to learn from that.
Okay. And so are you done with the interview process and kind of gathering data? And if so, what's next for AfroMindz then, now that you found all of this?
Yeah, I think we're definitely done with that first documentary in terms of AfroMindz. But I think
there's going to be more documentaries?
I will not. No, Bolly's going to kill me when she sees this. She's going to be like, you're signing me up for... But no, what I would love, because I really have enjoyed the process of learning and speaking to people about a topic that's really important. I think there's so many topics like that in our community that we need to really talk about.
Yeah.
I don't know if I should say this one just before, if I said it, someone else might just do it. But there are just so many topics that I just feel like we need to address this in our community because, you know, things are not always going well for us because we're, you know, closed mouth. We don't want to so guarded about things that have solutions. So I think we could definitely produce on another topic.
Okay.
Which is equally important.
Yeah. Okay. Just something that you just said there was about sort of that culture of being quite closed-mouthed, safeguarded. My question is, how on earth do you think we can attempt, and I say we because it's not just one person's responsibility, but how on earth do we challenge a whole culture and a manner of being if for generations and generations, particularly within the Black community, there has been that kind of hush-hush culture about you don't tell strangers or people outside what's happening in our house. You don't air your dirty laundry outside and all of that kind of leads to preventing people from speaking up and accessing help and reaching out for support. How do we even begin to deal with that? Because I don't believe that in 2023 that's something that we've completely resolved in terms of the culture of transparency and being able to admit that we're struggling and we don't have the tools and resources to support a family member, a friend, a member of our church community. And these people are suffering in silence. Do you know what I mean? But where do you even, because I don't have the answer, where do we even begin in trying to challenge that culture?
I don't have, to be honest, I don't have the answers. And I think it's a long-term process. The reason why I definitely think it's something that we can do in terms of a long-term approach to it is because I work in change management and I've seen when we do behavioural change is one of the toughest type of change to address.
Of course.
In comparison to like a technology-based change. And most of the time we start with like getting people to understand that there is an actual problem. And I think with us, you have to be careful in terms of the African and the Caribbean community because you want to kind of like be proud of the culture, and those things are fundamental to our culture. So what you don't want to do is be saying, okay, you need to throw it in the bin. We don't want to say that. But what we want to say is by being like this, sometimes it results in this, basically just calling it out very clearly in terms of the types of behaviors that aren't actually benefiting the community and actually showing the actual outcomes of some of those behaviors so that people can start to look at it and start to think about whether actually, is this the best approach? Can I try something else? Is that something else going to be sort of better for me as an individual? And I think what we also are careful about is speaking about a huge group of people because we're all very different. So it's more of like from an individual perspective, like starting from one person to the next and then you get that ripple effect as a whole community.
Absolutely. I agree with that. And there was something that you said there about sort of you making a distinction between Africans and Caribbeans. My question there, going back to your findings in the documentary, did you observe any ethnic differences? Were there any differences in sort of accounts, stories and experiences of the Black African interviewees and the Black Caribbean interviewees?
I think our pool was very biased in the sense that it was mainly African. And then we had a few people with the Caribbean descent. So I think it probably wouldn't be a good reflection on, we can't really make any concrete conclusions on that. We'd have to have a bit more of a balanced, sample to be able to make those conclusions.
No, the reason I ask is that with my research I'm doing with the Black women in teaching, I'm finding that there seem to be personality differences, some cultural differences that were influencing and shaping lived experiences. And I was thinking, I can't explain what I'm seeing, but I'm seeing slight nuances there. So I just wondered if that was the case. Okay. Now, looking forward then to the next couple of weeks, months, what could we be looking out for in terms of AfroMindz events, campaigns? Is there anything that we can look forward to?
Yeah, definitely. I think what we have coming up quite soon. In May, we do have another screening, a public screening. That one will be in Leeds. We've done a couple in Manchester already. So we do want to get it out to different cities in the UK. So Leeds is on our top list for May. And then we want to take it to the south.
Right.
Because we had quite a spread in terms of representation in the documentary. So we want to make sure that every city that was represented gets an opportunity to watch it. And we are very keen for people to get more opportunities to watch it. So it's even in the case where we're saying to churches, for example, they can host their own screening with obviously with our support and guidance and things like that. And even organizations as well, we do offer that. So it's just about reaching out to us and we will try and figure out something that works.
And in terms of that event in May, who is your target audience? Who is it for?
So it's literally for anyone who's interested in the topic of mental health, a Christian, if you're not even Christian, but you're Black or not even Black, if you're just interested in the topic of mental health and maybe ethnic minorities, how they see it, you want to learn something. I think even watching it back with people of different ethnic backgrounds, they've learned something, that we've had a lot of feedback to say that actually I relate with this regardless, even if they don't have the same cultural background. So anyone literally who's interested can come along.
Thank you. And finally then, for the church leader, the organizational leader, manager, supervisor, whoever it is that might be listening, and if they feel that they actually want to connect with AfroMindz and organise a screening within their organisations, how might they reach you and organise that?
So we have an email address that we can share we'll share the email address, as well as we are on Instagram. It is Afro_Mindz with a Z, so MINDZ. And you can follow us on there for more frequent updates.
Lovely. Thank you, Tilly. Thank you for your time. That's been really helpful.
No, thank you for having me.
Absolutely. And maybe we'll get you back again in May for Mental Health Awareness Week to have a further conversation. We'll see about that. But yeah, thank you for your time.
No, thanks for having me.
Thank you for listening to this week's episode. To make sure you don't miss the next one or the one after that, ensure to follow us on all podcast platforms and subscribe to our YouTube channel. Thank you.